So how do we target these proteins with drugs? What are the agents that are out in the clinic? This is a snapshot. This list is growing widely very quickly for clinical agents and investigation for small cell lung cancer. So let's first focus on DLL3. The original antibody drug conjugate that was studied in small cell lung cancer was actually not a success story. This was called Rova-T, and it failed to demonstrate benefit for patients with small cell lung cancer. This was the first ADC to market with DLL3 before tarlatamab, actually. That was the DLL3 bispecific T cell engager. And so that while this was a very prominent target, up to 70–80% of small cell lung cancer having this target, the antibody drug conjugate Rova-T was unsuccessful in inducing response. Only about 12% of patients responded. And then many of the investigators who were on this study and many of the patients who graciously participated in this study, it was unfortunately too toxic and not effective. And so all that glitters is not gold. And so Rova-T was not further explored. It did not receive any FDA approvals and is not in the clinic. But we were able to learn the lessons from Rova-T and help refine those. And so now there are many successful antibody drug conjugates with additions and changes to the linker, the payload, the antibody, and how we really employ these antibody drug conjugates in the clinic. We learned from those lessons and were able to improve on that for future patient trials, particularly with ADCs in small cell lung cancer. One exciting drug is called I-DXd or ifinatamab deruxtecan. This is an ADC targeting B7-H3 or also known as CD276 on the surface of small cell lung cancer. And what you can see here is patients received it as demonstrated here. This is a waterfall plot because we want to see the areas under the curve, the waterfall being predominantly on the lower part of the side, meaning this is shrinkage of the tumor from baseline at 0 when the patient started the study. So we'd like to see it all the way down at 100%, meaning a complete response, no visible tumor. And so the deeper the waterfall, the better patients are doing, and this is what we want to see. And so you can see here with the role of this antibody drug conjugate, it's B7-H3, a number of patients having an objective response here, hovering around 50% of patients having shrinkage of more than 30% of their small cell lung cancer while on a trial. This is so exciting and really evidence that this is a really meaningful target, a meaningful investigational agent. You can see that patients who are on the study, each of these little spider plots being a single patient, and you can see patients kind of over time, each one, we want to see again shrinkage of the tumors and then maintained over time, again, getting as close to 100% of shrinkage on these target lesions um, with the summation over time. And then to remain on that same trajectory over time. And that's what we do see on this agent is that patients, when they had shrinkage, it was usually on the first scan at 6 weeks, even before that 2-month mark, and that it was durable over time. And that's what you can see is that it was maintained with duration of treatment, and the many months range is what we want to see for who are having response on this therapy. Again, here, this is the progression-free and overall survival, meaning how long was a patient on therapy before the tumor started to grow or change. And that on average was about 5 months. Again, this is a median. This is not an absolute of one patient, but the collection of all the patients studied. And then the median overall survival for patients on this study was 10 months. Again, with this, this is really a compilation of all the patients on the study, with each one of those individual hashes being representing a patient. And so while this is a major improvement, we want to see, 2, 3, 4+ years. We want patients doing well. So there's definitely room to improve, but very exciting on this drug to see this activity. One of the really exciting pieces of these antibody drug conjugates is the activity in the brain. We saw this data at ESMO, the annual European Oncology Conference, just earlier this year, showing a patient's MRI. You can see the one here on the baseline on the left, At 6 weeks, dramatic shrinkage, and at 30 weeks, that was maintained. And this patient had platinum resistant relapse. This can sometimes be a more aggressive type of small cell lung cancer. But regardless of that, this patient's had a brain metastasis that shrunk due to treatment and stayed really undetectable in the third line setting of receiving this agent. Again, really unprecedented and so exciting for our patients and their families. You can see here, this is again looking at the concordance of patients who had response in the brain, but also response in the body. We see that systemic, meaning the body, and the CNS, meaning the brain, that we see that matches up about 69% of the time. And really, I think that that number could be actually higher, but so many of the patients had complete responses, meaning there's no evidence of tumor on the brain scan, where there may have been slightly a little bit of tumor still on the scans on the body on the systemic side, maybe allowing for the concordance to not be 100%, but still having shrinkage. And you can see those bars going in the right direction or the same direction for the majority of patients here on the study. This is what we want to see. We really want patients having success stories, both in the areas in the chest, the body, the bones, the liver, but also in the brain, which could be a sanctuary site for small cell lung cancer.